Hi, members. It's Jennifer Marusak again. And today we're fortunate to have with us Senator Fred Mills, a Republican out of New Iberia. Well, actually, it's out of Parks, isn't it, Senator? Parks, Louisiana. Senator Mills is the Vice Chairman of the Senate Health and Welfare Committee, and he's also a member of the Finance Committee, two committees that are extremely important to LSMS members. Now, Senator, why don't you talk to us a little bit about your bill that you are carrying on behalf of the LSMS, and that has to do with the shared savings plans that are in the Medicaid model.
Yes, the shared savings model. We want to make sure in this bill that we protect the shared savings model. You know, it's proven in the studies that the society has done is that it saves money. It works, it's user-friendly, we all like it, so we need to make sure we protect it, and the society is doing a good job of getting this legislation together, and we're looking forward to the debate because it just makes good economical sense. It's good for the patient, and it's really, for once, it's something the providers can hang their hats on.
Senator, I know that the Finance Committee has already been hard at work going over the executive budget that the Governor's office submitted to the House. Typically, you all see the budget probably around Memorial Day. But I know, again, you've had those briefings, you've been meeting with your staff. So what's it looking like from your perspective?
I guess from the revenue side of the budget, what we've seen in Senate Finance is maybe some of the revenues aren't really as strong as we thought they are. And you know, your members all have businesses. The revenue stream's what's important. I think what's important for all of us as people that want to protect our providers, especially our medical providers and our physicians, is that no more rate cuts for Medicaid. We have to stay exactly where we are. We'd like to get more, but we have to stay where we're at. And I think we have to make sure we prioritize our network of physicians that take care of the Medicaid population. Stay tuned. It's going to be a battle, and the revenue side is shaky, but we cannot, once again, jeopardize the payment stream for our providers, especially our physicians.
You know, Senator, one of the issues that is continually extremely contentious for LSMS members are scope of practice issues. I mean, we've had legislation filed in the past where nurse practitioners would no longer have collaborative agreements or physician supervision. This year, yet again, we have the physical therapists that want to practice without physician diagnosis or supervision. And we also have the optometrist back. So what do you think in general about these scope of practice issues?
You know, I guess from scope of practice, I always want to defer to the physician's expertise. I'm a firm believer in a collaborative practice agreement that the physician should be the gatekeeper. If the physician feels that certain ratios make sense for him or certain leeways of practice standards make sense for him, I'm fine with that support. Independent support of practice standards, we'd all have to sit around the table and we have to look at the educational piece. We have to look at areas of need in the state. Maybe there's medically underserved areas. But the society is doing a great job of educating us as far as what it takes from a science standpoint. At the end of the day, it really all comes down to the patients, protecting the patient's health, safety, and welfare. But then it all comes down to what's the expertise, what's the training, and what's the science. And it's always going to be a battle between the science, the economy, and what's good for the patient.
In 2012, you brought forward some legislation dealing with pharmacists and vaccinations and immunizations. Now, your legislation then would just allow a limited number of those, specifically, I believe, for shingles and pneumonia, added to what the pharmacists could already administer, and that would be for the flu. Now, this year, legislation has been filed to allow pharmacists to administer all CDC recommended immunizations and vaccinations. You know, that's really a hard pill for our members to swallow, so to speak. We thought in 2012 we kind of had an agreement that that was all. That was all that was going to be discussed, and the pharmacies would not be coming back. But they're back. Please explain to our members, from your perspective, what's going on with that legislation.
Yeah, and I thank you for giving me the opportunity. Yes, I think was it 2010 we opened it up for. We had the pandemic flu episode, and that was something we all kind of agreed to. We needed all hands on deck. A couple of years ago, we basically had it where we limited it and we said, hey, these are the ones that make sense. I think it was influenza, Zostrix, and pneumonia. Pneumonia was the other one. I did get a request from the National Association of Drugstores to basically have a debate on all the CDC protocols. The side of their argument right now they're telling me is that I think over 20 states are adopting those CDC protocols. I did caution them that I thought that the medical society, which is true, is going to basically come back and says tetanus can be a real problem because it needs to be a diagnostic skill. Pediatricians are calling me right now saying that is the hook. That's what brings them in here. I've told the other side, I've told the National Association of Drugstores, that's the issue. We're going to have the debate. I promise with the society that I'll work with all sides on that. But it's one of those things that I guess I'd like the members to know when somebody wants at least democracy and the opportunity to debate it, it's hard not to give them that chance to debate it. So I think on this piece is somehow, somewhere, you know, and the society knows that somehow when we're making sausage, it all turns out. I'm just not sure how it's going to turn out.
Well, that's a good segue into what you and I were talking about earlier, and actually last night on the phone as well. And that's some of the work that goes on behind the scenes.
Yeah.
Like you said, when we are talking about the results of the session after it's all over with, that's some of the things that we really don't necessarily pinpoint. So what would you like to talk to our members about with that?
From the members, and there's so many members inside it that are friends of mine and colleagues of mine, I think what I'd like them to know is that the work that the team does, the administrative team of the society, so many times you either take bad pieces of legislation and put them to bed, or you take something that's really confrontational and you make it work. Because we all do have to live together. All of the practice groups, at the end of the day, we have to live together. And like yesterday, there was a bill on balanced billing, and you guys did a terrific job of letting us as members know why the bill was not ready for prime time, and the bill was defeated. So I guess at the end of the day, we all get in a skirmish, but somehow it works, and your team does a great job, and I think that the members of society can rest assured that you got their best interests at heart.
Well, Senator, thank you again so much for your time. I know you have a very busy day ahead of you. I know you're going to get to spend the end of the week back home with your family and in your businesses for your real job, if you will. But again, we appreciate your support of LSMS, and we greatly appreciate your time today. Thank you.
It's a pleasure to work with you. Thanks for giving me a chance to address you.